Hi, I am Lauren Honkin. I am a board-certified OBGYN, a mom of 3, and a former IUD user, and I want to talk to you today about IUDs. An IUD stands for intrauterine device, and it's just what it sounds like. It is a method of birth control that goes inside the uterus. People might want to consider this type of birth control if they're looking to set it and forget it, essentially have to remember to take a birth control pill every day or use a method of contraception every time they have unprotected intercourse to prevent pregnancy. Another reason that people might want to consider an IUD is because they may have heavier periods, and the progestin IUDs can help decrease bleeding. So the main advantages to using an IUD as a form of birth control is that you can set it and forget it. So that means that you don't have to remember to take a birth control pill every day or do something every time you have sex to prevent pregnancy. Also, if you get a progestin IUD, it can decrease the amount of bleeding that you had, or it can make your bleeding or your period go away completely. The other good thing about IUDs is that they are extremely effective. So they are more effective than having your tubes tied, and they're reversible. So that means when you place it, it's more effective than having your tubes tied. You can have it in place as long as you want, depending on the IUD, up to 10 years, and then you just get it taken out when you're ready to get pregnant, or you're ready to switch your form of contraception, or you don't need contraception anymore. So there are 5 different types of IUDs. There's a copper IUD, and then there are 4 different types of progestin IUDs. The copper IUD is also known as Paragard. It's good for 10 years, and it can cause heavier bleeding as a side effect. So if you already have a heavy period, you might not be interested in this one because it's going to cause heavier menstrual cycle, more cramping, and that's usually the most common reason people get it removed. The progestin IUDs, there are 4 different types, and I like to say they sound like sisters. So Mirena, Liletta, Kyleena, and Skyla. Mirena and Liletta are basically the same thing. They have the same amount of progestin in them, the highest amount of progestin in any of the progesterone IUDs, and they last for 8 years to prevent pregnancy. So they are going to give you the highest chance of not having a period or having less bleeding. Kyleena is the next down as far as level of progestin is concerned, and it's good for 5 years, and then Skyla is good for 3 years. There is a little bit of difference on the size of the IUDs too, with Kyleena and Skyla being the smallest. I don't think the size will make that much of a difference in the placement, essentially. So the way that these IUDs work to prevent pregnancy, the progestin and the copper IUDs work by changing the way that sperm moves. So sperm's not able to get to the egg. It's actually something called the acrosomal reaction. And so if the sperm cannot meet the egg, fertilization can't happen and pregnancy can't happen. And then the progestin IUDs also thicken your cervical mucus, so they are further not going to let sperm get to the IUD. And then a good thing to know also about the IUDs is there are 3 that can be used for emergency contraception: the Paragard, Mirena, and Liletta, and they are all up to 99% effective at preventing pregnancy if you place them within 5 days of unprotected intercourse. They are the most effective form of emergency contraception, or a most effective way to prevent pregnancy after unprotected sex. So if you're planning to get an IUD placed, but you're nervous about the placement, specifically pain during the placement, I can give you a few tips to help you. First, you want to choose an experienced clinician, someone that places IUDs all the time. Second, you want to pre-treat your pain. So you're going to want to take Motrin in the waiting room. Also, sometimes your doctor will give you some Valium, or you can ask for that specifically to help you relax in the waiting room and during the procedure, which can help decrease pain. You also can bring some headphones, listen to music, or you can opt for a more invasive option, which would be a paracervical block where we inject lidocaine around the cervix. Like with everything in medicine, there are risks to IUD placement. So I just wanted to talk about a few of the risks. One of the ones that concerns people the most, I think, is uterine perforation, and this is when the IUD is placed at the wall of the uterus. It's an extremely rare complication. About 1 in 1,000 placements this happens, but this is why it's important to find an experienced clinician to place your IUD. The other risks, or the other things that can happen really after an IUD is placed, is that it can come out. So this happens about 1 in 20 IUD placements. And another thing that I should tell you is that you should not use a menstrual cup with an IUD, because this can actually pull the IUD out. In about 10% of patients, the IUD can be malpositioned, and this basically means it's not in the ideal position at the top of the uterus, and it can cause irregular spotting or pain. Another common side effect of the IUD, or something to know before you get it placed, is that you may have some irregular bleeding, some spotting right after it's placed, and then your period should get lighter and lighter, especially if you get the Mirena placed, until hopefully it eventually goes away at 6 months. But some users can experience light spotting or some irregular spotting throughout the duration of the time that they have the IUD in place. Overall, IUDs are an awesome form of birth control. They're super effective and they can help with heavy periods. So if you're considering getting an IUD, you definitely should talk to your doctor or your clinician to see if an IUD would be the right fit for you. I hope this video has helped you understand IUDs more, or maybe come up with some questions that you need to ask your doctor to understand more about IUDs. Thanks for listening today. If you liked this information or if it was helpful to you, please like and comment and follow along for more content like this. As always, I am happy to be your friend, the OBGYN.